Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV. Thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Beth Jones. She's the Community Impact Director at the Northwest Arkansas American Heart Association. Beth, thank you so much for being here.
Of course. Thank you for having me.
So Heart Month is coming up, and the theme this year is You're the First Responder Until Help Arrives. Can you explain the significance of the theme and why the American Heart Association is emphasizing it?
So we have found that over 350,000 people experience cardiac emergencies outside of the hospital. So that is anywhere from at a school football game to while you're shopping in a store or just at home. So we really emphasize you being the first responder because a lot of times you see people that are going to have a cardiac emergency around you every day.
And you touched on this a little bit, the immediate action by bystander. It's so critical during a cardiac emergency.
Yes.
What does data tell us about survival rates when CPR is started before EMS arrives?
So if CPR started prior to EMS arriving on site, we see either 2 to 3 times the survival rate.
Wow. And many people think cardiac emergencies happen mostly in clinical settings, but how common are cardiac arrests at home, school, or in public places?
Very common. So unfortunately, it's happening more and more. And only about 41% of people who have cardiac arrests or cardiac emergencies outside of the hospital receive the help that they need and survive those.
And AHA has really been a national driver of hands-only CPR. What should everyone know about how simple it is and why hands-only CPR saves lives?
So hands-only CPR is very simple. Unlike traditional CPR, there is no breath aspect of it. It is just compressions. We say to find your favorite song that is 100 to 130 beats per minute. Staying Alive by the Bee Gees is the one that American Heart Association talks about the most, but we've also found there are some other common artists that we hear on the radio today that also have songs that are that same beat, and have that song be your beat as you are doing CPR and sing it along in your head, and just do CPR as long as you can until the paramedics arrive.
And what barriers keep people from performing CPR, and how does the AHA work to overcome those fears?
So most of the barriers that we've found in the last few years have been the breath aspect, especially after COVID. A lot of people are really anxious about that. That's why we've done a lot of research and worked with a lot of organizations to figure out what we can do to help people feel like they can step up in a bystander situation. That's kind of where hands-only CPR came from, and we find that it's almost just as effective as traditional CPR up into that 10-minute point after a cardiac emergency. Other barriers can be women are much less likely to receive bystander CPR. There's just concerns about where you have to do CPR on the body, and that can kind of be in the way for some people. So we like to raise awareness that women are less likely to get CPR so that people will be thinking about it before an emergency happens so that they are more ready to step up and help when that needs to happen.
And a major focus this year is increasing access to CPR kits in schools. Why is school-based training such an important place to start?
So there is a couple of answers to that question. So in Arkansas, there is a law now that students from 9 to 12 have to learn CPR in schools. There's also some other laws around where AEDs need to be placed in schools. There was a recent law passed that all schools have to have a cardiac emergency response plan on site so that when a cardiac emergency happens, there's no question about what people need to do or who needs to do it. It just happens. Again, cardiac emergencies happen more likely outside of a hospital setting or a clinical setting. So we want at least one person in every household feeling confident and comfortable to practice CPR in that emergency instance. And that includes kids as well.
And can you share what the AHA is doing in Northwest Arkansas to expand CPR training for students, teachers, and school staff?
Sure. Yeah, we are working with schools in Arkansas to get those cardiac emergency response plans in place. Those plans also include education as far as CPR for staff and making sure there's people there who are ready to act. And then that also trickles down to the kids as our school engagement people start working with our schools, doing different programs and teaching that cardiac emergency response and CPR.
And for schools or districts that want to adopt the CPR kits or training programs, what steps can they take and how can partners like healthcare organizations help?
So the first step would go to our website and find our local office in Fayetteville and reach out to them. They can get you in contact with me or of our school engagement personnel, and we can start that conversation. If someone's wanting to fund that opportunity, again, reach out to us and we will find a way to make that happen.
And you touched on AEDs. Tell us about them. They're another life-saving tool that often go unnoticed until they're needed. What should communities understand about AED access and usage?
So we work closely with some of our local fire and EMS to help raise awareness of what AEDs are. They're the defibrillators that you see in cabinets around the community or in other public places. And we are trying to help make those more accessible so that in the instance of a cardiac emergency, you have an AED on site and there within seconds of the emergency happen. One of the really cool things that we get to do is help local nonprofits and other businesses and organizations make sure that they have access to AEDs because it is such a life-saving equipment that we can help raise that awareness of where they are, and then also help people have other organizations as well having cardiac emergency response plans for when that happens.
And is Northwest Arkansas seeing progress, or are there challenges in placing these in schools and even in rural areas?
There's always challenges. That's just part of public health. But we are seeing a lot of growth in our area here. A couple of our fire and EMS here locally are leading the state in AED placement, and we are really proud of them. And we are trying to spread that more into our rural areas where response times are longer so that we have more AEDs accessible, even though our EMS may take just a little bit longer to get to the emergency.
And for healthcare leaders, policymakers, community partners that are watching, what are the most impactful ways that they can help support not only Heart Month, but this year's first responder initiatives?
So really looking for those community organizations who have a place in this conversation. It's not just us. We're not doing this alone. So finding those other organizations that can be support, and then to support American Heart Association. Again, if this is, calling you at your heart, reach out to us locally, and we would love for you to get involved. We have quite a few events coming up this year, and we would love to have more people there helping us raise awareness about cardiac health and cardiac emergencies and how we can all be a part of it.
And helping involves, they can help donate a CPR kit, they can sponsor training, even bringing programming to their organization. What is the best way to start?
The best way to start is to get a hold of us, find our office number and give us a call. We would love to start that conversation with you. If your business or organization would like to be involved in setting up a cardiac emergency response plan, let us know. We can help with that as well. And if you're just wanting to support this work locally here, again, there are lots of ways to get involved in different methods. If rural health is what you're looking to support, we have options there. If you're looking to help support some of our rural schools, they need our support as well, and your support. But really, just get touch with us, give us a call, and we would love to get you involved in the community.
And Beth, as we close, is there one message you want every viewer to take away about being prepared to save a life?
It's not a if question anymore. If you will have contact with someone who has a cardiac event, it's a win. And so being prepared and having that knowledge of CPR is so crucial in today's environment, because cardiac arrest is the leading cause of death in the United States. So making sure you're aware, making sure your friends and your family are aware, that's all so important.
Well, Beth, thank you so much for sharing this important information for our viewers. And I appreciate all that you're doing and for the awareness of Heart Month that's ahead in February. Thanks so much.
Yeah.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.